Good morning. So what we wanted to do was find out how effective that hard lockdown, the level 5 lockdown, where everyone was locked in their houses, unable to go out except for essential services and so on, how those measures compared with mitigation strategies that were in place prior to the hard lockdown. So you may remember before we even went into hard lockdown, we were already having bans on large gatherings. There were already restrictions on alcohol sales and so on. So we wanted to see just how effective that real hard level 5 lockdown that stopped business happening in South Africa, how that worked relative to mitigation strategies.
Yeah.
So what we mapped the rate of new daily cases against the various different levels of lockdown, starting with the mitigation strategies, going right through to level 1. And what you'd expect to find if level 5 lockdown was effective would be a sharp decrease in the rate of new daily infections 7 to 14 days after that restriction came in place. You see, there'd be a bit of a delay due to the incubation period of the virus. And then a little bit later, when we started relaxing the regulations, if it was an effective intervention, you'd expect to see the new daily cases go up again. And the thing is, neither of those things happened.
Yeah.
There was a sharp decrease on around about the 27th of March in the rate of new daily cases, but that can't be attributed to the lockdown because it's too early. It was on day 1 of the lockdown, essentially, and any effect it might have wouldn't actually materialize for another week or so. And then when lockdown restrictions were relaxed, we didn't see an increase in new daily infections. In fact, it started to tail off. The curve started to flatten around midway through level 3. So really what our findings are in a nutshell are that level 5 lockdown, there's no real evidence base to suggest it's any more effective than the standard mitigation strategies we had in place initially.
Yeah. As you suggest in your article, Dr. Smart, it is easy to be correct after the fact. Question is, the decision to go into the hard lockdown in the first place, was it a correct one or was it wrong to begin with?
Well, my colleagues and I at the University of Johannesburg have been arguing that it was the wrong decision from the start. Essentially, evidence-based medicine wants you to look at the contextual conditions of the people that you're dealing with. And in South Africa, a large proportion of the population live in high population density living, townships, informal settlements, urban areas, where a lot of people living under one roof, where effective social distancing is going to be very, very difficult, even if people are trying their absolute hardest to abide by this hard lockdown regulation. When you have 10, 15 people living in under one roof, it's impossible to effectively social distance. So you have to bear the contextual conditions in mind, and we just didn't do that. Of course, lockdown involved lots of different regulations, some of which are more sensible than others. But that's sort of the real core of level 5, which was preventing all but non-essential work and keeping everyone inside, was not sensible in our context. It's understandable insofar as it would have been a high-risk move for government to essentially go against what the World Health Organization were offering as blanket recommendations internationally. So in essence, there's a question as to where to place the blame. Do we place the blame on the World Health Organization for not taking contextual conditions of different countries a little closer to heart, or do we blame government for not being a little more proactive? Because it would have been a very risky move on government's part to ignore that advice.
Yeah, exactly. And that's why in my next question, I'm going to argue with you a little bit about whether any of these drastic measures did not give us some breathing space in some areas. But before I get there, you have suggested in your article that significant damage was done to South Africa's existing health programs. Are you able to give us a list of those and perhaps quantify the damage?
I can make a start. The full extent of the damage done by lockdown is not going to be known for quite some time because diseases like HIV take a while to kick in. However, there was a 57% drop in HIV testing from March to April, 1.6 million in March to 590,000 in April, as travel restrictions put constraints on community testing. And as I say, we're kind of restricted to projections at this stage, but Imperial College project that these kind of restrictions are going to result in a 10 to 20% increase in HIV and tuberculosis deaths over the next 5 years. So that's really a significant impact. In addition, the workforce has been massively affected. A nationwide study saw that 50% of workers, 47% of respondents were actually unable to buy food by the end of the month in April due to their loss of income. And of course, when you can't feed your family, that is a health impact itself.
Let's go back then, Dr. Smarts, to that very point I made to you earlier, that I was going to argue with you a little bit about whether or not these drastic measures of the hard lockdown had no effect whatsoever. If you look at the rate of road accidents, right now, coincidentally, we're going into the festive season, and I've just spoken to a colleague who is at the scene of about 5 people who've just lost their lives from the northwest heading to the Eastern Cape. Then you also look at the emergency units in hospitals that experienced less pressure when we had less people on the road. Are you saying that we should be dismissive of these facts?
No, absolutely not. It would be absurd to deny that banning people from driving cars slows down the rate of accidents. It would be absurd to suggest that banning alcohol and closing taverns and bars prevents alcohol-related admissions to accident emergency units. And in some instances, it's very sensible to do this. We didn't advocate against the alcohol ban, for example. The alcohol restrictions were sensible. In a situation where the hospitals are packed, one way to reduce the pressure on the hospitals is to slow down as much as possible alcohol-related admissions. Yeah. And again, with the road journeys is a similar thing. Although you have to look at this holistically and see. December is a very different time to March and April. Every year South Africa has a horrendous number of deaths on the roads in December as people flood to the coast for their holidays. I'm certainly not suggesting that government does nothing. What our study suggests is that locking people in their houses and only allowing essential work to go on probably does more harm than good, because similar results can be achieved in terms of slowing the spread of the virus simply by banning large gatherings, encouraging hand washing, sanitizing, and sort of just general sensible behavioral change.
Yeah, the economic impact of the hard lockdown, Dr. Smarts, paint that for us. Because as I speak to you, it is still being fought through the courts, even though we are down at lockdown level 1. The AfriForum has just lost their urgent application to try and have beaches remain open. The economic impact of this, in particular, right at the beginning, have you been able to quantify what that has worked out to?
Well, not me personally, but I can quote you some statistics from Stats SA. They say that the net number of South Africans in the workforce dropped by 5.2 million during the second quarter of 2020. That the poorest 50% of workers who live hand to mouth, of course, were affected 10 times worse than the richest. So, as is so often the case, the poorest South Africans were affected worse than the wealthier South Africans. And we live in one of the most unequal societies in the world, as we all know. And GDP dropped by 16.4% between the first and second quarter. And this would lead to an annualized growth rate of minus 51%. Now, we saw the restrictions relaxed, and the difference between Q2 and Q3 was quite encouraging. We saw a more than 13% growth in the economy, as those lockdown restrictions were relaxed. So it's quite clear that a hard lockdown has a huge impact on the economy, and the economy affects the health of people. It affects malnutrition rates. It affects the amount of tax money that the government can then spend on future healthcare. So these are important things to consider, and I would really strongly recommend that government doesn't send us back into anything resembling level 5 lockdown. But I don't get the impression that they're planning to.
Yeah. Final point, Dr. Smuts. You make a very, very compelling argument about the age demographics on African states, and that the COVID-19 primarily affects the elderly, and therefore, to your point, that the hard lockdown was, quote unquote, always wrong for Africa. So as we now enter the second wave here in South Africa, in your view, what would be the most suitable interventions for countries like ours as we experience the second wave?
Truth of the matter is, hard lockdowns shift the health burden from the elderly to the young. That is the general shift. So a hard lockdown protects the elderly population, but puts the younger population at risk. So it's always the young population that's at risk of malnutrition and so on, and the elderly population that are at risk of COVID. And in Africa as a whole, only 3% of the population in Africa are over 65. So really, it doesn't make much sense to shift that burden from the elderly to the youth when South Africa, as a country in itself, has a young 27 average population. It just doesn't make any sense. However, it does make sense to continue being vigilant, to continue to prevent large gatherings. These matric rage parties are absolutely absurd. I just simply don't understand how these things happened. Ultimately, these could result in the deaths of many, many people because of some really, quite frankly, stupid behavior. That needs to be broadcasted widely and saying, look, this needs to stop. Hard lockdown is a bad idea, yes, but remain vigilant, remain sensible, keep wearing your mask, keep sanitizing, don't meet in large crowds. As for the beaches, open spaces, diseases, respiratory diseases spread less easily in open spaces. That's true, but South African beaches get so busy in the summer that if you have that many people in one space, then it's inevitably going to result in a number of cases. How many? It's impossible to tell. Yeah. But there's this new variant that is apparently more contagious. It's something to worry about, and I just feel like maybe this Christmas is one where you need to think about the elderly in your community, be a little bit more cautious, and social distance as much as you can.
Sure. On that last point about the beaches, I'm interested to know what your opinion would be. Open or closed?
I'm going to get in trouble for this, but I'm going to go with closed.
All right, Dr. Benjamin Smuts, thank you very much for your time.